started fighting Medicaid cuts in 2003, I think. So it's longer than 15 years. And those cuts took effect, and we've been trying to get it back ever since, you know. So it's really a joyful week for so many of us. But there's a lot for us to do, and still, the vote was the first big hurdle, but we've got a lot more hurdles to get through before expansion takes effect. So I'm going to walk through what we know so far. And I think you can see my screen now. Are you all seeing that?
Yes.
The slides, okay. And you all know this, you were working the polls, but 53% of Missouri voters approved this. And that's compared to 47% who didn't, right? That means that we ended up with a 6-point margin. And I don't know about you, but I am getting annoyed by every media person who calls that a squeaker in Missouri. It's not really close. That's a big deal. That's a big margin. It means that Missourians really do support this. The ones who didn't were getting the bad information that so many of us saw that was out there floating around. But that is a big deal. That is not a squeaker. So you should all be very proud of your work on this. So what's next? The Department of Social Services has to apply for a state plan amendment to its Medicaid program. They apply to the Centers for Medicare and Medicaid. That needs to be submitted by March 1st. Lawmakers also need to include funding for the program, the federal funds and any state funds that are required in the fiscal year 2022 budget. And the debate on that budget will start officially with the new legislative session in January of 2021. That's the budget that takes effect in July of 2021. It's called the fiscal year 2022 budget. We expect there to be a lot of legislative and administrative activity around both the state plan amendment, the budget, but also other legislation focused on improvements to the program. And I'm going to talk through some of that. But we also expect, legislative activity to disrupt expansion, and we're going to have to be fighting against that simultaneously. So we've got a long, year still before we get this implemented. I mean, I think we should all take a break and congratulate ourselves, get a little rest and gear up for the next year. We're almost there, and we can do this, but there will be fights. So what are some of these, knowing that lawmakers were sharing misinformation, but also that they were receiving misinformation about the impact of Medicaid expansion, we think it's really important for all of us to be talking about the benefits, right? Like, this is what this does. And helping our lawmakers understand that, particularly suburban areas and in rural areas. There are 230,000 Missourians will benefit from this. These are working Missourians, right? Unlike some of the messaging that we received from people about these helping people not work, this really is for working Missourians, right? Those who are trying to support their families, struggling every day with low wages, and this is to help them. While 24% of Missouri's population is rural, 33% of those who will benefit from Medicaid expansion directly live in rural communities. So what that means is that this is not an urban thing, right? It is rural communities that will benefit. And you can see in this map, the darker blue are the areas where they have a higher percentage of their population who will benefit directly from Medicaid expansion. So, you know, in some of the rural counties, it's higher than in our urban areas, that higher percentage. And it's going to be important for lawmakers to recognize that, right? To help them understand this is not an urban thing. This is not just about supporting St. Louis and Kansas City, right? It's about our entire state. And indeed, even though expansion passed in 8 counties that are largely urban, right? St. Louis County, St. Charles, on the Kansas City side, I think it was Jackson, Clay, and Platte, and then Greene County and Boone County. Those are largely our urban counties where it passed. In rural areas of the state, 175,000 rural voters voted for it. And in some counties, it was really close. Like we're talking just a couple of votes between the yes and the no, right? So we're going to need to help our lawmakers understand that their people in rural areas support this too. That's going to be really important to overcoming the legislative hurdles that we face. So we're just starting to pull together that messaging. And you all know this, 16,000 jobs, right? Helping our lawmakers understand that these jobs are going to be spread throughout the state will be important, will be supported by expansion. And we're going to save money in our state budget as a result, save general revenue. Yeah, we will actually reduce existing costs in general revenue for existing programs that are largely state funded or have more state funding than the new Medicaid expansion in them, because as people move into expansion, we're going to be able to reduce those existing programs. So we end up with, you know, more in savings than we will have in costs in terms of general revenue. There will be no reason for the state to cut education or other services because of those savings. So we, contrary to the messaging that some of our elected officials are using, right? This is going to be really important for them to understand. And those savings are not unusual, right? States throughout the country are seeing those savings. They're seeing new revenue come into the state as federal funds flow into our local communities. That will actually generate new state revenue too, just naturally, you know, generate state revenue. And we've seen, you know, since we waited a number of years to implement this, we've got good research, right, from other states now that have implemented this, have implemented it for a number of years. And we found that broadly, those states are reducing health disparities. They're increasing positive health outcomes for folks. They're reducing family debt, increasing economic output as a result and of that reduced debt, and they're bringing in new revenue to the state and seeing budget savings. So I think there have been something like 324 analyses of the positive impacts in other states already. So those are some of the big things that we're going to try, some of the big broad messages that we're going to try through outreach to lawmakers, help them understand, right, what all of the benefits are. But in addition, we're going to have some challenges that we're facing. And some of these challenges existed long before, right, expansion happened, and they haven't been fixed. They've just kind of been muted during COVID, and I'll explain that. So one of the challenges is our enrollment system. Our Medicaid enrollment system is really antiquated. Our applications are extremely complicated for each program that families need, whether it's childcare or food stamps, SNAP, now called SNAP, or Medicaid. they have a different application. And the Medicaid application is excessively long and uses legal language and terminology, making it very difficult for anyone to understand. I don't know if you all have looked at the Medicaid application, but it's very confusing. I've looked at it, and it's a struggle. It's a struggle to get through. So, our system, our enrollment system being antiquated, and some policies that were put in place beginning in 2018, like annual renewals requiring annual verification of income, the lack of changes to how the caseworkers were assigned clients in the Department of Social Services occurred simultaneously. A new computer system occurred simultaneously. A phone system, call center that was overwhelmed, dealing with all of the people who were receiving notices and being asking for help, ended up in more than 128,000 Missourians wrongly losing Medicaid coverage over a period of 18 months in Missouri. Those folks largely were still eligible for Medicaid, but were cut off because the state, they either couldn't get through to the call center, they didn't get a notice from DSS saying that they needed to send something in, they didn't understand the notice. They, couldn't reach anybody for help at the call center, and this resulted in a huge, what some people are referring to as the purge in Medicaid. That all stopped. Those annual renewal notices, the elimination of benefits if people didn't respond to notices, stopped with COVID. So there were waivers put in place specifically in response to COVID that resulted in people being able to retain Medicaid. So some of those problems have just been kind of in sleep mode over the last several months since March. They will return once COVID is over and we start implementing those same policies again, unless we can fix them, right? So this just shows you the wait time in the call center. And you can see that during 2019, the wait time was as much as 40 minutes on average. And that was an average number. We know people who waited hours on hold. And low-income folks can't do that. They simply can't do that, right? I can set my cell phone beside me and have it just waiting for my call to be answered while I still work. But if you're working someplace that you can't do that, you can't sit on hold for 40 minutes. I also don't have young children who are running around needing me, right? Well, those wait times went down to just 2 minutes because we stopped doing the annual recertifications. We stopped requiring people to send in information during this time of COVID. We're going to have to deal with this. And if we want to implement Medicaid expansion smoothly, we need to implement some policy changes based on what we've learned so far about what created the problems in the first place, right? So over the next year, we're going to be working administratively with officials in the department, with the governor's office, as well as with legislators. So we'll work both on administrative changes and legislative changes. We need to streamline our application, make it much easier for people to understand, integrate the application for these various services so that if you're applying for Medicaid, you can also apply simultaneously for childcare and SNAP. We need to really simplify the language and put all of the legal terminology in the back We're going to have to implement some use of technology, right, to maximize efficiencies. Some of these things just make sense. There are things that other states have done for a long period of time, and we just haven't. So what can the state has the ability to do electronic income verification so that families don't have to find paper, statements and send them in. We also have the ability to increase in the use of technology by creating user-friendly accounts that kind of walk people through, right, what they need to submit, which will help a lot when in terms of reducing the number of inaccurate addresses that the state has. But we also want to implement 12 months continuous coverage. One of the policies that the state started to implement that created a problem in Missouri is a 3-month quarterly review. So every 3 months, the state workers, as well as individuals receiving Medicaid, have to kind of recertify that they're eligible. And that's a huge burden, and it results in a significant churn, right, of people going on and off the program. One of the things that other states have done is instead implement 12 months continuous eligibility. So if you're eligible today, we're going to assume you've got coverage for 12 months. And that would reduce not only the burden for the state, but also reduce the problems that families face. That had significant momentum in the legislature. 12 months continuous coverage actually had some momentum in the legislature at the beginning of the legislative session this year, and then COVID hit, and we had to, everything stopped. And I think that we need to return to this when we come back in the new legislative session. Those are just some of the things that we know right now. There will be more, right? These are just some of the things that we know right now that we could do. We also expect that we're going to be fighting some really negative things in the negative proposals in the legislature. Legislators last year brought up work reporting requirements, and there was a big push to try to get those through and put on the ballot at the same time as Medicaid expansion. Essentially, they result in steep losses in Medicaid coverage. Arkansas, 25% of those lost coverage, 40% in New Hampshire. They're very costly. We did an analysis of what it would cost to implement that in Missouri, and it would be about $200 million each year just to implement the management of that. So, the courts are striking this down, work requirements, and rightly so. Striking these down throughout the country, but that has not stopped our lawmakers from proposing them. What I was very concerned about is that they would be, at the last legislative session, it was an attempt to put these on the ballot at the same time as expansion. I was very concerned that would confuse people and disrupt the vote, right, on expansion. But I would not be surprised if they don't try to do something similar to work reporting requirements or some other barrier for folks that we'll have to fight them on. I would not be surprised if they don't try to cut eligibility or services in other categories. So they may say, oh, we have to cut kids eligibility because we've got this new expansion. Oh, we have to cut dental services for everybody because we've got this expansion. I think that there will be definitely an attempt to undermine expansion. Even if none of these things go through, it's the messaging that gets out to the public about they will try to use this to message that expansion is bad and move these policy issues to say that expansion is bad. Let me stop there for a second. Though that's what we know right now about what we face in the next year. There's definitely more than that. Everybody needs to kind of regroup still and create a plan. We're researching, investigating different options on what have other states done that have gone smoothly. What do we want to avoid in terms of pitfalls? The Missouri Foundation for Health has just released an RFP for an analysis of that. They're looking to get, a national expert to do an assessment of what's worked in other states, and we won't have that until October. That assessment. It's going to be a quick turnaround, really, with the Department of Social Services to get the waiver request into CMS, since it's due March 1st, according to the ballot measure. We expect also, just so that you're not shocked by this, you probably know this already, but we do expect that there might be a lawsuit relatively soon to try to stop the implementation of the ballot measure. And it's related to funding that the state constitution requires that lawmakers appropriate. Lawmakers have the authority to appropriate funding. And so the argument that some will try to make in this lawsuit is that the Medicaid expansion ballot measure forces the legislature to appropriate. And so that could be a constitutional challenge that we face still. And there are definitely already attorneys who are working on that. So I think what I'd like to do, if it's okay with you, Sandy, is have questions.
This morning, my beautiful girl. Down, 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 down.
Take any questions or comments first on this stuff before I talk about other things.
Well, everyone should put them in the chat.
Okay.
Or raise a hand or unmute yourself, and we'll see if we can pick them up one at a time.
I have one question for you, Amy.
Sure.
Yes, Crystal, okay. Go ahead.
I did a lot of work when I was in medical school with the Rural Projects of America through Department of Health and Human Services. And I read there's a lot of rural hospitals that, hospitals have to close. And people in rural counties all across the nation, and especially in Missouri, they have to drive very far to even get to medical care.
Yes.
Because there's no hospital. Is this going to improve that for providers to come back?
Yeah, we've had 10 rural hospitals closed in recent years. And, I don't know if those providers will actually return or if those hospitals will reopen, but definitely in the states that have expanded Medicaid, the coverage in rural areas helps to shore up the health care infrastructure in those areas. So it helps to retain the hospitals and clinics that are in existence. So absolutely, I think it makes a big difference in terms of access to care.
Amy, I'm wondering if the messaging is going to go out to the general public about what other states, the other 37 states have seen, because I thought that was one of the best parts of your presentation, was showing us how other states really have saved money. I mean, it's what we're saying, but to see it actually, it has happened. I'm wondering if that's some of the messaging and how that's going to get out so the public does show support. Obviously, what happens with the governor's race in Missouri in November will have a huge impact on this. But I would assume that educating the general public would also shore up support for going forward with this. You know, I don't think Missourians want to see another rehash of what happened with Clean Missouri.
Right.
And I think that's the big fear.
Absolutely. Yeah. So yes, I think, you know, we are working with some of the partners in the Yes Unto campaign, as well as, you know, the Missouri Foundation for Health, the healthcare, or I'm sorry, I still call it by its old name, Health Forward Foundation, you know, in Kansas City, and others, to try to, you know, pull together what those top lines are, and then we'll be asking everybody to message. So social media and forums and any, you know, different types of communications with lawmakers. I think we just have not, we just don't frankly have a plan yet. But that will be coming together very quickly. I expect that to come together, you know, really within the next several weeks. And, you know, it'll begin in the next several weeks, but then really evolve too, as we learn more and can put more into place. But I think it's critically important. You're right, to have both, and, you know, the public understand it and lawmakers.
Amy, Donna had a question here. She thought that there already had been a lawsuit on the forced funding issue to keep it off the ballot, and it was denied. Was there such a thing?
So there was a lawsuit. The question of whether or not this contradicts the part of the Constitution which says that lawmakers are charged with appropriations authority, could not actually go to the court until after the ballot passed. So that's, you know, for whatever legal reason, that's the way that works. So I think that we, you know, I think we face a potentially significant challenge with that. There are really good attorneys already working on it.
Sorry to hear that.
Yeah, me too.
Cheryl, could you expand on this item you put in the chat? I'm not sure I saw anything. The Washington Post article. Cheryl Barnes, are you there?
Yes, sorry, I couldn't get unmuted.
Okay.
I just saw that the Washington Post did an article, and I saw it this morning where you were quoted. Could you talk about their coverage of passage of Medicaid expansion?
Sure, yeah, it was E.J. Dion, and he is a syndicated columnist. So he did essentially an opinion piece on the importance in rural areas, and that rural areas should really support it. And you know, he talked to me for the piece that he wrote. But I think that runs in newspapers throughout, not just throughout Missouri, but also across the country, including the Washington Post. But I know it ran in the St. Louis Post-Dispatch. I think it's going to be in the Kansas City Star too.
We have it.
Okay. Yep. You know, I think one of the ways that we get the message out about this impacting rural areas too, and the importance in rural communities, is going to be through that type of media outreach.
That E.J. Dion article is in yesterday's Star in the op-ed section.
It's great. I think Alice had a question.
Alice?
I just wanted to amplify what Amy was saying. When you saw the map, the legislature is overrepresented by the rural communities. So that makes our job really hard. She has not overstated the challenges. So take your breath now, but the hard part is now coming in. It's different because it'll be with our elected officials. But the other thing is that those of us that have worked on voting obstacles, if you think those are impractical, the application process to become eligible is 10 times worse than the obstacles that we know in Missouri for voting. So, you know, when you keep the door closed, you make the lines, you plug the lines, and then you don't have appointments, you keep the system from working efficiently because they don't want it to work efficiently, because if you keep the numbers down or you wipe them off by a purge, then you don't have to spend state money, and the state saved a lot of money when those 100+ people were purged. So we have to be ever vigilant at the administrative and operational side, and we probably should be consumer watchdogs.
Yes. Absolutely.
The notion of models that have worked well, especially in red states, and I guess
Yes.
what Oklahoma is the most recent.
Yeah, Oklahoma just passed it at the ballot as well, just about a month before us. So they have not yet really implemented it, but they could give, they're just one step ahead of us. But there are definitely conservative states across the country that have implemented this, that we can look to for any sort of message guidance that worked with their lawmakers. I think that, for us, the challenge, we face a unique challenge, I think, that as compared to other states, in that term limits have really disrupted that historical knowledge and the collegial atmosphere, right? When term limits hit in Missouri, what we saw is a turnover that we haven't had since the Civil War, right? And that just keeps happening every 8 years. We have this turnover again. So you end up with lawmakers who don't know anything about any issues. They're listening to whatever the party head says, right, about just do this, or Medicaid is bad, and we end up with struggles that we can't overcome because they're not building those relationships. So I think that we have some unique challenges because of that, but we can definitely learn things from other states.
Can the things that are concerning the administrative issues, the language, application processes, and all of that, can those be more or less matched up against other states' approaches to them, so that we can show, here's complicated, here's simple language, here's better ways of doing it. You don't have to invent this if it's already working somewhere else. And can that be
absolutely. Absolutely. Yep. And there is definitely interest in that. And so the Missouri Foundation for Health contracted with Sevilla, a group out of Detroit, and they just finished an analysis of how to simplify and improve our systems, simplify both the application but the systems as well. And that analysis was done for the Department of Social Services. The Department of Social Services has it and has not actually released it yet, but this was all just completed a couple of weeks ago. So I expect that will be, hoping that will be coming out, relatively soon, so that we can all use it. And I can nudge a couple of people about that too, because I know that we'd all like to see it. So I know that there were a couple of questions in the chat too that I don't want to miss.
Donna mentioned one here.
Yeah, is it the Department of Social Service or the legislature? Who writes the implementation plan?
The Department of Social Services writes that. Yep. The implementation plan. And Oh, Evelyn, you asked about rural voters voted, the percent of rural voters who voted for or against Amendment 2. We are digging into that more. You know, you can go to each county and see, right, the county level breakdown. But what we're doing is our partners in MOVE, I don't know if you're familiar with MOVE Action, Molly Fleming is in Kansas City, and she is the director of MOVE. They are doing a sunshine request to get some more detailed information about that will show us, you know, the percent of Republicans that voted for it as well in different counties, so that we can have some more, you know, depth to our data that we share with lawmakers then.
I have a question regarding that. If these people in these rural areas are benefiting from Medicaid and they voted for it, it seems like it would be, we need to go through them to contact their legislators who are putting up the barriers.
Yeah.
They need to understand that their legislators that they voted for are trying to take this away from them.
Yep, absolutely, yes, yeah. And there are lots of really good, strong grassroots partners that are working in those communities already, trying to help people do that. So
I hear there's also an a rural indivisible group that is starting to, and I don't know if it's just in Missouri, but I think they already had a big meeting, but I think that they're trying to do an indivisible kind of organization among rural people who are aware that this is going on. The reason these clinics are closing is because of this.
right, yep, that's great. That's great. I wasn't aware of that, so that's fantastic. Was there another question?
There is. Dawn mentioned, will there be a volunteer effort to assist applicants with their process?
I don't know the answer to that yet. I don't know if anybody has information on that, but I don't know. I don't know.
Mary Lindsay says, is there analysis of the wasted administrative costs of the unnecessary efforts to keep applicants off Medicaid or to throw them off?
Yeah, we've got some analyses from other states that say, you know, you could reduce administrative costs 7 to 10% just based on what other states have done. Now, that's not Missouri specific, but I think we can definitely, you know, we wanted to wait on the Sevilla report to know what the recommendations were going to be, really the strong recommendations to push forward. And, but we can definitely, I think, put some numbers behind that. So there's one other thing that I definitely want to talk to you about. But let me just say that, you know, this is all evolving, right, still. So we definitely can come back when we know more. There definitely will be ways that we can have everybody working on these issues. And I wish I knew more about what that was right now. We just aren't quite there yet. So one of the things that we do have is we facilitate something called the Missouri Health Partnership. And if you are, we send out regular email updates, but we also have regular phone calls, particularly during the state legislative session. We have those weekly phone calls. All of you are welcome to join us for that. And I can, you know, if you just shoot me your email addresses, I'm happy to add you, and I can make sure that you all have my contact information. I will send the slides to Sandy, I'm assuming I should send them to you.
Sure, that's great. Thank you.
And my my email and contact information will be in there too. So love to have you join us with that.
Got a couple more questions here. Don is mentioning, could college and law students maybe be pressed into service to help with applicants as a volunteer base?
Yep, and those are great ideas. Those are great ideas.
Donna, you want to ask your question? Sounds pretty good.
Well, what is the sense of spending 200 million to be sure people are working to be eligible on Medicaid and yet not spend money to give people health insurance?
Yeah, there's no logic. We've tried to understand that for years, right, Alice? There really isn't. There's no logic. Sometimes, I mean, it's horrible, but sometimes you just have to laugh because it's the only way to like push through it, right? Some of the comments, we did Facebook ads in specific areas the last several weeks where we really were trying to reach people to debunk, some of what the misinformation out there about what this would cost, and the, comments that we had about illegal immigrants and, abortion and, all sorts of stuff that's not accurate. It just drove me a little bit crazy. So sometimes that happens with stuff in the Capitol too, right? Drives you a little crazy, and the only way I can stay sane is laughing at it a little bit.
So the reality is the Social Service Department will write the plan and all, but you're expecting all of these sub-bills that'll come in trying to control other issues around Medicaid.
Absolutely. Yep. And I think that there will be opportunities for administrative advocacy as well, working, with the department. Yes. Okay. There is something else that's going on that's really urgent that I wanted to mention while I'm with you, and that's the federal debate, right? On the, I'm sorry, let me look at the chat fast. Just had it disappeared. There it is. It's great. So there is the federal debate happening right now on. I'm sorry, I'm struggling with everything happening at the same time on my computer. Okay, federal debate happening on the next COVID response bill. And you may see a lot of this in the media now that, some Medicaid expansion is passed and the August primaries are passed, but, or you may already be seeing this, that there is tension between what the House has passed and what the Senate wants and what the president will agree to. So they have not been able to come to agreement on the next COVID response bill. They had expected to pass the bill by yesterday, and they're not done. And several things happened because of that. We've, the expanded unemployment assistance, pandemic unemployment ended at the end of July. We are running out of some of the waivers that support Medicaid changes, and SNAP changes are expiring as well. So people will, for instance, work requirements in SNAP for food assistance had been suspended rightly so, because of COVID and people being unable to work, those are being implemented again. So people who are unable to find work, or because unemployment is extremely high, folks who are not able to or worried about working because they're putting themselves or their families at risk of COVID, could lose their food assistance as well. So we've got all of this is bottlenecked. All of these problems are bottlenecked in disagreements between the House and Senate and the president. One of the things, in addition to needing to pass, expanded unemployment, extending that for a longer period of time, an increase in the SNAP assistance, extending some of the waivers longer through, because we know COVID is going to be with us for quite a while longer. One of the things that has happened because unemployment has skyrocketed is that our state revenue is decreasing. And the state of Missouri has not put out an official estimate of what the decrease will be. As I understand it, the governor wanted to do that and the legislature refused for whatever reason. So almost every other state has an official state estimate of this. Barring that, in the absence of that, we did our own estimate of what we're looking at, and we compared what our revenue was in fiscal year 2019 with what the projection was based on the budget that passed, that's the green line, and what we actually think our state general revenue is going to look like based on what we know so far of the crisis. And we expect unemployment to remain high through 2021. So we're looking at about a $1.3 billion decline in revenue between fiscal year 2020 and fiscal year 2021, followed by a $1.9 billion in state revenue decline in fiscal year 2022. So the combination, well over $3 billion decline in revenue means that Missouri will have to cut services without federal assistance. Right? If we don't get federal assistance, we had significant federal assistance was provided during the Great Recession. Lawmakers, or federal lawmakers this time so far have passed very limited assistance. And this shows you what that is so far. The largest of these is the Coronavirus Relief Fund. That was provided to the state. $817 million went to our counties. 1.5 billion is for the state to use. It is excessively restricted. It is not flexible funding. It is not to be used to fill the shortfall that we face. So we can't use it to prevent cuts in education or other critical services. It has to be used for new costs associated directly with COVID. And that's one of our problems, right? Not only is the amount of funding too little to really help us avoid cuts over the next 2 years, it is also, it's also restricted, so we can't use it for that purpose anyway. So one of the things that's incredibly important for the Congress to include in the next bill that they're currently debating is significant flexible state fiscal relief, as well as an enhanced FMAP, having that extended. The FMAP is our federal matching rate for Medicaid. It means that we can, when they enhance it, when they increase it, it means that we can spend less in our state match for our Medicaid program. It protects Medicaid services. It has a maintenance of effort requirement, meaning that you can't implement in the state cuts that are, or eligibility restrictions that are more harsh than what you had when you first started receiving the enhanced FMAP rate. We expect right now that we'll, based on what they have already approved, that we'll have, you know, just shy of 700 million in additional revenue from the enhanced FMAP. But that ends at the end of this year, this calendar year. We're going to need it next year too. So one of the things that we're asking folks to do is reach out to our senators, reach out to Senator Blount, Senator Hawley, and ask them to include federal fiscal aid for the state in this bill, in addition to the extension of unemployment benefits and enhanced SNAP benefits and so forth. And I can send that information specifically to Sandy when after we're done today. So it would be great to have your help on that. And this is my contact information. If any of you need me, and I'll send that to Sandy too. So.
Are there any other questions? Amy, thank you very much. This was a lot to take in, and what a steep hill after getting over this other steep hill.
Right. Yeah. So. Thank you. Yes. The work continues. We are never going to be out of a job, I think.
No, I'm sure of that. Well, look, as I said, we want to help any way that's effective. And I will go back to, I'm not sure who it was that said messaging. I think it's Laura. Messaging is the big deal. I'm a firm believer if we can break it down simple enough for people to see over and over again what the main issues are. And especially if we compare it to places that have worked, that don't look like a coastal large city, then we maybe have a chance of being heard.
Right.
Yeah. I had a couple of questions real quick. Has Missouri expanded their unemployment benefits longer than 20 weeks?
So the federal, the state unemployment benefits, no. The state unemployment benefits are still just limited to 20 weeks, but the special federal pandemic unemployment assistance is expanded. And I think it was expanded significantly. So it wasn't, this is off the top of my head, I think it's 35 weeks.
Okay. Well, and I would just add, from our election protection, we want Senator Blount and Senator Hawley to actually also include money to protect elections in this next bill.
Absolutely. Yes, absolutely.
And Amy, I had a quick question. Does the Missouri Budget Project, do they have other projects, or is this their singular issue?
No, we do. We work on a number of issues. So in addition to Medicaid, we do work on the state budget. So I didn't give you the spiel. I forgot to give you the spiel about us, but the Missouri Budget Project, we formed in 2003 because that was right after term limits. And at that time, there was a lot of, we also were reeling in the state from the stock market crash following 9/11, and that was reducing state revenue, and budget cuts started being proposed. And there was very little information out there about, what was happening with revenue situation and how to fix it, right? So, and there was a lot of partisan debate going on, which, has just grown since then. But we decided at that time that people didn't know or didn't have the tools to really actively advocate on the budget and tax policy issues that the state was facing. And so we first formed really about helping people engage in state budget and tax policy issues. And we've got an array. Go ahead.
And so you are a volunteer organization?
I didn't quite hear. Stacy, I lost Stacy.
You're a volunteer organization?
Oh, no. I'm sorry, I lost her again.
Are you a volunteer organization?
Okay, so we have a staff. We've got 6 staff members spread kind of across the state. Actually, 3 of our staff members and one of our consultants that is almost like staff are all in the Kansas City area. So Brian Colby, who's our Vice President of Policy, is in Kansas City, as our Tracy Gleason, our Vice President of Public Engagement. Our Research Director, Lindsay Baker, is in Kansas City. Then we work, Jeremy LaFavor does work for us as well. And then I am in St. Louis with our office manager, and we have folks in Jefferson City as well. So we're kind of spread out, but we started in my house with just enough money for me and one other very, very part-time person. And we've really developed in the last 17 years.
And where do you get your funding?
We have a variety of state and national funding partners. So some of the ones that you'd be familiar with are the Health Forward Foundation, the Reach Healthcare Foundation, the Francis Family Foundation. Those are all in Kansas City. We also, the Annie Casey Foundation is one of our national partners, as the Ford Foundation and the Rockefeller Foundation all fund us. The Missouri Foundation for Health. There are a number of others as well, Deaconess and the Rob Lee Foundation. So it's, mostly foundation-based.
What's your relationship with Kaiser?
So the Kaiser Foundation does not provide funding for us, but definitely we use their research. They've got great research on their website that we access and utilize.
Great. I think Donna had one last comment here.
Yes, yesterday you all received a email about the celebration of the centennial of the 19th Amendment. It too is going to be on August 29th, but it's at 2 p.m. via Zoom. So you can do the earlier one in the morning and do this one. And they're going to have Nicole Evelyn will speak about Virginia Minor, the Missouri woman who wanted to vote and took her case all the way to the U.S. Supreme Court in 1874. There also will be a virtual tour of a historic exhibit and some messages from the Virginia Case, our U.S. LWV U.S. Executive Director, and Deborah Turner, our President of the National League. So I hope you'll all Zoom in for that one. It should be interesting. You can have a full day of Zoom.
And
Thank you.
Donna, will that be on our calendar so that people can go right to the calendar and access that?
I'll share that with Pat.
Great.
Pat, if that's okay with everyone.
Certainly. Any other announcements?
This is Pat. It is on the calendar.
Okay, thanks, Pat.
Never a doubt.
She's snappy.
She is.
It's so good to see everyone.
Yeah, nice turnout. We really appreciate you guys zooming in, as Donna just said. And Amy, once again, thank you very much. I know we'll be glad to have you back and help us sharpen our help on your behalf and all our behalf.
Well, thank you. Thank you for having me.
Yeah.
Thank you, Amy. Thank you.
Absolutely.
Yeah, thanks, Amy.
Can we also plug next month's program on gerrymandering?
Please do. If I could do it myself, I would, but I can't. Anyone have that? Pauline, are you still with us? She is. Unmute your Pauline.
speak.
Here you go.
Oh, I'm sorry. Dr. Robin Kuhlman will be our speaker in September on the subject of gerrymandering, which she has written quite a bit about. So it should be very interesting and fit in with our Fair Maps priorities for this year.
Great.
And we'll have, more information about the title of it and all soon.
Okay.
Okay.
And we'll be spreading more information on RIGD, the Voter Suppression Playbook webinar for the 8th of a month from today. So.
Can I just throw in, I saw that the census is they've shortened the amount of time the census workers have, and I think Kansas City is just at 57% of people reporting in to the census. So that kind of worries me a lot, and that has a lot to do with gerrymandering too. So anyway, the census, I think, is a real concern.
Yes.
Okay, thank you.
All right. Well, thanks, everybody. If there's nothing else, I'll end the meeting. Thank you.
Laura, do you want to say something about book club?
Yeah.
Do we come to a different Zoom?
Yes, if you are in the book club, we are reconvening at 12:30. I wasn't sure how long this would last. I wanted to give us an hour between, and it is a separate Zoom. It was in your, it came from membership on Monday, August 3rd. It's a separate Zoom there. If you did not get that, would you quickly email me and I will send it back out?
And also, if you're not in the book club but would like to join in.
Absolutely.
Laura.
Thanks, everybody.